We're going to talk a little bit about the erector spinae muscles and go over some anatomy for those muscles. But just in the interest of time, let's talk mostly about the lumbar erector spinae and the thoracic erector spinae muscles. So let's start with iliocostalis. Iliocostalis is the most lateral of the erector spinae muscles. It originates from the posterior sacrum, the posterior iliac crest, and the erector spinae aponeurosis. It's going to insert on the lower 6 ribs, ribs 7 through 12. Now, if we follow that muscle up, the iliocostalis cervicis portion of this erector spinae muscle is going to originate from the upper 6 ribs, ribs 1 through 6. And it's going to insert on the transverse processes of C4 through C6 in the base of the neck. Next, let's talk about longissimus. Longissimus is the middle of the erector spinae muscles, sitting a little bit closer to the spine than iliocostalis. It originates from the posterior sacrum, the spinous processes of L1 through L5, and the posterior iliac crest. It's going to come up and insert on all of the transverse processes of T1 through T12. So it runs the length of the thoracic spine. And this is longissimus thoracis we're talking about now. Then if we move even more medial, we have spinalis. Now spinalis is interesting in that it does not originate until higher up in the lumbar spine. So its origin is the spinous processes of either T10 or T11 through the spinous processes of L2 or L3. And it's going to travel up, attaching to the transverse processes of all of the thoracic vertebrae as it comes up. Now, all 3 of these muscles, iliocostalis pretty much ends at the base of the neck. But the other 2, longissimus and spinalis, both come up and attach higher up in the cervical vertebrae, and they go up and attach into the head. We'll get more in depth with what's going on there cervically in another video. Collectively, in the trunk, in the thoracic spine, and in the lumbar spine, these muscles are going to do extension, lateral flexion of the trunk, and same side rotation of the trunk. Obviously, these muscles can be affected by the bones that they attach to. They do run the length of the vertebral column, even coming up through the cervical vertebrae and into the head. So the position of the head on the neck could affect what's going on in the erector muscles all the way down in the sacrum. The position of the sacrum, or compression in the sacrum, could affect what's going on in the erector muscles all the way up into the head. It's also possible that, again, if we're leaning or if we're carrying something chronically, right, so that we're raising that hip, kind of leaning over into lateral flexion, if we sit in a chair at night that has one armrest and we're leaning like this, that we're shortening the space between the ribs. And that's actually going to create tension in iliocostalis as it comes up and attaches to each one of those ribs all the way up into the first rib. So we can shorten the muscles in this way. As we do that leaning or we create lateral flexion to one side, we're also shortening the space between the transverse processes of all of the lumbar and the thoracic vertebrae. So that can create shortening of the erector spinae muscles. Now, the other possibility is that we have shortening because the erector spinae aponeurosis is actually coming from the base of the sacrum. So if something is going on at the base of the sacrum where that sacrum is sitting off to one side or another, if it's not quite level, if it's twisted more anterior or more posterior on one side or another, that could create tension in the erector spinae muscles. We also want to look at the thoracolumbar fascia because the erector spinae muscles sit between the medial and the posterior layer, middle and posterior layer of the thoracolumbar fascia. So that's the other structure that we really want to pay attention to when looking at tension in the erector spinae muscles. We will get to the cervical erectors in another video, as I've said a couple of times. But for now, these are the stats for the thoracic and lumbar erector spinae muscles.